Okay, so this is Bill Swarns, and I am recording a lecture on Zoom because I can't get my regular recordings to work. So, lecture burst on chapter 2021 that we'll be going through, and that. So, here we go. So, upper airway diseases that basically go anywhere above your epiglottis there. We'll start with the URI, upper respiratory infection. There are more than 200 different strains of viruses that cause upper respiratory infections, otherwise known as the common cold. Causes include rhinovirus, adenovirus, parainfluenza, coronavirus, get my mouth to work, and respiratory syncytial virus, and we'll discuss those individually in a short time. Coryza is one of the first things that you can notice with a upper respiratory infection is a clear watery discharge from your nose when you have a URI. Medication for this condition, mild decongestants or over-the-counter antihistamines. Nasal sprays may help relieve congestion, but may also become addictive and cause rebound congestion. Warm saline gargles and sore throat. Lozenges may help, along with mild analgesics for sore throat. Meds for this is Actifed, Sudafed, and other decongestants. Antihistamines, Dimetab, Trimeton, Travist, non-drowsy are Zyrtec, Allegra, and Claritin. Okay. So sinusitis, that is an infection or inflammation of your sinus mucosa membrane. And sorry about that. Amber alert went out on my phone. Where was I? Inflammation of the mucosa membrane, one or more of the sinuses in the skull. Pathophysiology is the opening that is in your sinus constricts and impairs the drainage that wouldn't happen normally. There's pain, tenderness, headache, fever, malaise, nasal congestion, purulent drainage, nasal drainage, and bad breath. Usually it lasts for about 10 to 14 days. If it is treated with antibiotics, some of the antibiotics that are used, there's ampicillin, augmentin, Bactrim, Septra, Cefatitin, Ciclor, Cefaclor, and Cipro. Topical steroids may also be used to reduce the nasal mucosa drainage, such as fluticasone and decongestants like Afrin. If there is enough damage to the mucosa, they will have to do surgery and have an endoscopic nasal sinus surgery, which I've had, and it has been a godsend. Before that, I was getting at least one sinus infection a year, possibly two. Was dependent upon Afrin to keep my nasal passages open, and has since not done that for the last 8-9 years. So anyway, that's a good thing to have. All right. Next is pharyngitis and or tonsillitis, spread by droplet nuclei. Incubation period of a few hours to several days, depending upon causative organism. Tonsillitis, symptoms usually resolve in 3 to 10 days after onset. Streptococcal pharyngitis manifests abruptly. High fever, sore throat, dysphagia, malaise, all that kind of stuff. Tonsillitis manifests with sore throat, difficulty swallowing, general malaise. Like I said, white exudate is present. Pressing on the tonsils can produce purulent drainage. Cervical lymph nodes are usually tender and enlarged. Bacterial pharyngitis complications are abscess, scarlet fever, toxic shock syndrome, rheumatic fever, and post-streptococcal glomerular nephritis. And you'll talk about a lot of those as you go through. Excuse me, gotta take a drink here. So next we go to RSV. RSV is a common virus that is a primary cause of respiratory illness in the elderly, those with immune suppressed individuals, and for infants and children. We see a big spike in this during the winter months, mainly in November through February, where the children's hospitals are absolutely full to capacity with children that have RSV. Transmitted the same way as other upper respiratory infections and is highly contagious. Treatment for adults are symptomatic. When lower respiratory tract becomes involved, then the patient may need to have hydration, intubation may also be needed to support the patient. People have depressed immune systems may develop pneumonitis. Incubation period is 4 to 6 days. Treatment for this is the same as a URI. So epistaxis, otherwise known as a nosebleed. 90% of nosebleeds arise from the Kisselbach area of anterior nasal septum, susceptible to trauma, drying, and infections. Posterior nosebleeds occur from terminal branches of the sphenopalatine or internal maxillary arteries. These are associated with disorders such as blood dyscrasias, hypertension, and diabetes. Posterior nosebleeds are more severe, more common in adults. Manifestations of anterior nosebleeds: obvious bleeding from the nose, from the nares, bleeding into the posterior nasal and oral pharynx. Nausea and vomiting can occur from swallowing the blood, and that usually is a what they call a coffee ground emesis. It looks like somebody is throwing up coffee grounds, and that's because it takes and goes in and your body tries to digest the blood and it breaks it down a little bit. Medications: topical vasoconstriction, chemical agents for cauterization, topical anesthetics if packing is required. Prophylactic antibiotic therapy is also used sometimes. Laryngeal tumors. Laryngeal tumors are basically cancer of the supraglottis, epiglottis, and the folds and the arytenoid muscles, cartilage, and false vocal cords. And invades locally, metastasizes early. Usually the first manifestations that they notice is a hoarseness that the person has, change in voice, painful swallowing, sore throat, or a feeling of a lump in the throat, dyspnea, foul breath, and pain that radiates to the ear are later manifestations. The risk factors for this, as you would expect, is tobacco usage, alcohol consumption, poor nutrition, human papilloma virus infection, exposure to asbestos, and race. Okay. Have a video here that is from YouTube, and it is on the changing of the tracheostomy care and suctioning. So I'm going to let you guys look at that on your own, because it's about 20 minutes long, and it's from a student doing it in the simulation lab like we have. Okay, so I'm going to let you guys look at that on your own. So, or obstruction, laryngeal trauma or obstruction. Now, this here is abdominal thrust, otherwise known as the Heimlich maneuver. You guys should have all been taught this in your CPR class. You stand behind the person, you wrap their arms around the person, waist above the umbilicus and below the diaphragm. Tip the person a little bit forward, and you grasp one fist and with the other hand, and then you push hard and quickly up and upward thrust, and that usually gets the object out. Continue until the object is relieved. If the person becomes unresponsive, you go lower them to the floor and you have someone go call 911 and you start CPR immediately. Okay. Like I said, this is something that you should have been taught in your CPR classes. Okay, so now we're going to the lower respiratory diseases that we're covering. One of the most common is asthma. Asthma is an inflammation of the lower airways that occur due to internal or external factors. Okay, affects 1 in 5 people in the world. So about 20% of the population has asthma of one kind or another. There's 2 types. There's extrinsic, which is allergic asthma. So something that you come in contact with outside of in the environment that causes you to have an asthma attack. And then there's intrinsic, which is a non-allergic asthma attack. And that can be caused from stress, it can be caused from exercise, it can be caused from all kinds of other things. Acute asthma results from increasing airway obstruction caused by bronchospasms. Assessment findings are shortness of breath, wheezing, coughing, and production of thick, tenacious sputum. Diagnostic findings, respiratory, expiratory, and sometimes inspiratory wheezing with decreased breath sounds in the bases. Bronchodilators are used to manage acute breathing disorders and reverse bronchospasms. So those are the, your bronchodilators, your albuterol, your Kovar, things like that, okay? Now we have influenza. I've only taped this thing 3 times this morning. So influenza, the influenza or the flu is a highly contagious viral respiratory disease characterized by runny nose, cough, fever, headache, and malaise. Influenza is passed through water droplet and direct contact. There are 3 major types. There is influenza A, B, and C, okay? Influenza is an airborne virus and is very easily spread. Global epidemics and pandemics are rare and usually take 10 to 15 years to develop. The closest thing we have seen in the past couple of years is the avian flu. And then this year with the coronavirus, the COVID-19. This has the aviary flu has a 50% mortality rate, but has not been seen to have a person-to-person transmission as of yet. But the fear is that it will mutate. Influenza A is the most common and dangerous of all influenzas. Type A influenza virus is found in pigs, birds, whales, and humans. Type A is blamed for 3 pandemic infections in 1918, 1957, and 1968. Type B influenza viruses are common in humans and are common in sources of influenza outbreaks, but not pandemics. Type C influenza viruses found in humans, pigs, and dogs are typically cause mild respiratory infection. So those are the ones that we have for right now. Okay, then we go to pneumonia. And pneumonia is a inflammation of the lungs parenchymal, leading to a pulmonary consolidation as the alveoli are filled with exudate. Eighth leading cause of death in the United States. Age-adjusted death rate of influenza and pneumonia per 100,000 population has declined from 53.8 in 1960 to 22.8 in 2006. And that is directly related to people getting their flu vaccination. Develops in 4 patterns: lobar pneumonia, bronchial pneumonia, interstitial pneumonia, and mylar pneumonia. Some of the complications: lung abscesses is a localized area of necrosis and pus formation. These people have weight loss, malaise, and night sweats. Emphysema is accumulation of purulent exudate in the pleural cavity, diagnosed with a CT scan or chest x-ray. A thoracentesis or chest tube may be needed to correct issues of pleural effusions. Okay. Severe acute respiratory syndrome, or SARS. Severe acute respiratory syndrome and SARS is a serious form of pneumonia. It is caused by a virus that has first identified in 2003. So it's a fairly new infection with SARS. The virus caused acute respiratory distress, severe breathing difficulty, and sometimes death. Majority of causes have been reported in China. Manifestations, usually symptoms appear 2 to 7 days after exposure. Fever of 38 degrees Celsius or 100.4, non-productive cough, shortness of breath, dyspnea, hypoxia. Mortality rate for SARS is about 11%, which is equivalent pretty much to what we're seeing with the COVID-19, okay? So tuberculosis caused by a bacterium called Mycobacterium tuberculosis. The bacteria usually attacks the lungs, but TB bacteria can attack any other part of the body, such as kidney, spine, and brain. If not treated properly, TB disease can be fatal. TB disease was once the leading cause of death in the United States. Back in the early 40s and 50s, they had sanitariums that were filled with people that were infected with tuberculosis, and there was nothing to treat them, and they died from tuberculosis. Intradermal testing or intradermal PPD, which all of you should have had before you came into school here. And you need a 2-step, which means you have to have the first one and read within 48 to 72 hours. And then you get a second one two weeks later, or you can get the blood draw. Okay, you can do that too. CDC recommends people screening for the following groups: people with high or at high risk for HIV, people with close contact, born in country with high incidence, medical underserved, alcoholics or IV drug abusers, residents and staff of long-term care facilities. That's one of the reasons why you need to have it done to test for tuberculosis, especially if you're not a US citizen, you come from other countries. You need to be tested, but you also need to be tested just because of the profession that you're going into as of nursing, because you have a higher incidence of exposure. Medication that they use is isoniazid, which is also known as INH, 300 milligrams daily or 900 milligrams 1, 2, or 3 times a week. Peripheral neuropathies and hepatitis is the side effects of it. Rifampin, 600 milligrams daily or 1, 2, 3, 3 times a week. Hepatitis, flu-like symptoms, colors fluids of body to orangish reddish color, ethambutol, EMB is 800 to 1600 milligrams daily or 2 to 4 grams twice a week. And then you get optic neuritis. And then you have streptomycin, IM injection, 15 milligrams per kilogram up to 1 gram daily or 25 to 30 milligrams per kilogram twice a week. Ototoxicity, vertigo, and nephrotoxicity is one of the side effects for that. Okay. So here is a Mantex video that you can watch. It gives you the link there. Go ahead and copy that and then go out and watch it. It shows you how to prepare for it, how to give it, and go from there. Okay. We'll let you watch it at home. Pneumothorax. A pneumothorax is an accumulation of air in the pleural space, not in the lungs. They're in the pleural space that is between the chest wall and the lungs. Okay, so that's what a pneumothorax is. There's also a hemothorax and a tension pneumothorax. The tension pneumothorax we're going to talk about. A hemothorax is where blood accumulates in between the pleural cavity, between your lung and your chest wall, and can cause a tension pneumothorax. Causes for a pneumothorax are spontaneous. You have blebs in your lungs that pop and start putting air into your chest cavity, but you also have, by complication of other diseases, results from blunt force or penetrating trauma. Iatrogenic causes is defined as a disease that is caused by medical treatment. Sometimes in medicine, we cause more problems than we cure. Manifestations is pain, shortness of breath, increased heart rate, increased respiratory rate, asymmetrical chest movement. In other words, somebody will take a deep breath and one side of the chest will move, the other one will not. And on that side that is affected, you have diminished or absent breath sounds. Okay. All righty, almost done here, folks. Lower respiratory tension pneumothorax develops when an injury to the lung or chest wall allows air to escape into the pleural space, but prevents it from escaping. Pressure within the pleural space becomes positive. Most of the time, the pressure inside your lungs pleural space is a negative space, negative pressure. So that's what helps you breathe. Manifestations like the pneumothorax, same type of symptoms. Presence of hypotension, low blood pressure, distension of the neck veins up here in your neck. All of a sudden they start pumping up. You can actually see them without looking. Displacement of the trachea to the unaffected side. So you have your trachea, it should be midline, as I used to call it. You look at from the patient laying in bed, it's between their eyes and their toes and their eyes. That's where the trachea needs to be. But it shifts off to one side and it's quite noticeable. And the person will have trouble swallowing and they will go into shock eventually. Okay. Treatment diagnosis is first when treatment, then treatment. Diagnosis is through ABGs, chest x-ray, good patient assessment. Treatment chest tube is placement and pleurodesis or even surgery. Okay. So manifestations of lung cancer. You have clubbing of the fingers and toes. You have endocrine, neuromuscular, cardiovascular, and hematological symptoms. Leading cause of cancer death in the United States. Population is age over 50, exposure to tobacco smoke, ionizing radiation and inhaling of irritants, and exposure to radon. Those are the major complications from it, or manifestation, populations that they would have it. Complications is superior vena cava syndrome, obstruction of venous flow of the head and neck, paraneoplastic syndrome. At diagnosis, most patients have metastasis of 39%. Of them have poor prognosis. 5-year survival rate is about 15%. So it's not very high for survival rate. Those rates are getting better, but there's still poor prognosis for lung cancer because of the simple fact most lung cancers are not diagnosed as early as they should. Most people have symptoms, but they attribute it to other things. My brother-in-law, he died a couple years ago from stage 4 lung cancer. He smoked all of his life, most of his life, probably when he was 17 years old on, and when he died, he was 62. He was diagnosed by stage 4 lung cancer. They gave him 6 months to live. He lived for 2.5 years, but he was, I mean, the quality of that life, I don't know how it was towards the end. He was not working anymore. He was more concerned with his wife and things like that, making sure she was taken care of, which is something that needs to be done. Risk factors, it increases with age. Family clusters do suggest a genetic predisposition. Cigarette smoke, which contains 43 known carcinogens. That means they have, cigarette smoke contains 43 things that cause cancer. So stop smoking, okay? I know I'm an ex-smoker, so I know how it is. 80% of all lung cancers cases are related to smoking. Asbestosis, radiation, and radon are other parts of the cancer-causing agents. And so anyway, hopefully this is not how you feel now at the end of this. I'm going to stop the sharing and stop the recording now. You can have any questions, you can come to office hours and ask those questions, and we'll answer them to the best of our ability. Okay? I'll talk to you later, and have a good day. Okay?